Hello, everybody. It's Dr. Eric Balcavage, and we're back for another edition of the Thyroid Answers podcast. And I have with me Dr. Erica Riggleman, my partner in crime when we do the podcast. How you doing today?
Doing great.
Well, again, we have another guest on our podcast, and we have with us Dr. Keira Barr, who I met at a recent ShyCon conference, and I was intrigued by her story. Most of the people we've had on so far have been kind of embedded in functional medicine and doing this for a while. But the neat thing is that Dr. Keira hasn't been doing functional medicine for an extended period of time. She's coming from the background of conventional medicine and now is kind of seeing what's going on in the functional medicine and starting to bring those two worlds together, which I think is really a cool thing. So, Keira, without any further ado, how are you doing today?
I'm doing great. Thank you. Thank you for having me on your podcast.
Yeah, thanks so much for being on. We're going to have a great conversation today, but I think it's really neat when I talk to traditional medicine docs or conventional medicine docs at the functional medicine conferences, and they are seeing kind of this change or seeing where, hey, there's this other thing that I haven't really done or heard about before, and maybe it's not as wacky as maybe I was told it is, and maybe there's some credence to what's going on over here. So can you tell us your story of how you went from conventional medicine practitioner to maybe integrating functional medicine?
Yeah, absolutely. So I think, like many of us, it comes from a personal experience. And I was in academics practicing dermatology and dermatopathology for years and had an opportunity to actually take a step back when we moved from California to Washington State. And during that period of time, I started to develop some GI problems, which turned out to be functional, and was diagnosed with SIBO and was getting prescription after prescription and just traditional approach to things, and I wasn't getting any better. In fact, I was feeling worse. And so I kind of fell into functional medicine, researching things, went to my first naturopath and experienced more of a holistic approach. And I just became so fascinated by it and wanted to study and learn more. And, it just makes so much sense in terms of the practice of dermatology. Our skin is not only a window to, but it's a reflection of what's going on with your entire body. And so, I've been very conscientious for many years about, what you put on your skin and what you put in your body can make a difference, but didn't really tie it all together because in traditional medicine, we silo everything, right? Like your skin is separate from your bones, is separate from your, your gut. But functional medicine is that beautiful, aligning of the entire system together. Right. And so, yeah, that kind of just has drawn me to it.
I love the connection between the two and your openness to it. There's a lot of, traditionally trained medical doctors out there that are so close-minded to it that they can't even see it from a different perspective. So I love that you have that open mind and that you are, it's more than just doing the functional medicine. You're probably getting better outcomes with your patients by addressing some of these other factors, correct?
Yes, it's true. And, I think it's really interesting. If you look back at our literature, there's actually a paper that was published recently, but it cites a reference back from the 1930s where these two dermatologists, Stokes and Pillsbury, looked at the connection between the skin, the gut, and the brain in terms of acne. And, there's a whole field of dermatology, psychoneurodermatology, and linking that together. But I think because a lot of people did think it was a little voodoo or not the mainstream, it was shoved under the rug. Mm-hmm. And now it's coming back out. So in dermatology, there actually is a long history of it, but it's ebbs and flows of people want to talk about it. They don't want to talk about it. They want to talk about it. So it's kind of nice to see the resurgence. And there's more studies coming out in terms of botanicals and herbal remedies and looking at true clinical trials of how we can implement these, I would say alternative or, just additional, right? We don't want to think of them as other. We have to incorporate it as just part of the process. So these additional methodologies that we can incorporate for our patients.
Do you often get pushback from your patients who are coming in and they have some sort of, rash, or they have acne, and what I see is they want to fix now, and most people don't want to wait. Do you get a pushback when you're trying to treat something that's maybe acute, but then trying to make them realize that maybe for long-term results, maybe we need to address some of these other things?
I think yes, and I think that it's very in line with probably all of what you deal with in functional medicine too. You have to find the right patient who's open to it and who's willing to put in the hard work, because it is not a quick fix. I know that myself. I mean, I'm still in the process of recovering, and so yeah, I think that people are open to it. They're very confused initially, and so sometimes, if it's an acute situation, you do need a bit of a Band-Aid or a quick fix to get them over to the hump, so that they actually have the wherewithal, the mental fortitude, and intention to be able to take those next steps, to look at what they're eating, to see what they're putting on their skin, and all of that. So it's definitely a process.
Yeah, and I think, Eric, what you said, it kind of hits the nail on the head, is that, we all want the quick fix, right?
Right.
And if we can get the quick fix, get a quick result in 1 or 2 days, then, for most people, they're like, I can see that, it's done in a day, I'm good to go. And if I just take this, if I just have to take that and that's good, and I don't have to make changes, then life is good, right? The problem is that we haven't educated people to really understand that every medication has an effect and a side effect. And sometimes in the world of functional medicine too, we get off on our tangents, and we are some in our world and may think that medicine in all aspects is bad, and I don't think that's the case. Medicine has its best effect in acute situations, right? And so if you've got if we talk about skin, dermatitis, rash, itchy something, and you've got hives, and you need support, that's what the meds are for. The change in the diet, that's going to take some time, right? That's going to take some time to change. And if you want some immediate results, those things are good. I think the tough part is getting the person to get engaged and involved in their own healthcare, and understand that, hey, this is a short-term fix. Like this, as I just said at a talk I just came from, meds are like Fix-A-Flat, right? So it works. It definitely works to make a difference. I can blow a tire up in seconds with a can of Fix-A-Flat. The problem is, if I do that every day, I will have a tire that's blown up every day, but I got to do it every day. And at some point, that tire is going to blow out, and I'm going to have other effects or side effects. And medications can be the same way. So I think in general, it's a tough deal for both us as functional medicine practitioners, and you as the conventional medicine doctor trying to transition into this world to say, okay, I can do this for you, but this is a short term. This is just temporary. I don't want you to get caught up in this, that this is the long-term solution, because there will be ramifications if you do this for too long, too consistently. And we need to put this other work in to get things done. And again, you're probably right. There's people that are like, nope, not doing that.
Right.
There's definitely people that are like, oh, well, nobody ever told me that before. I've been to 4 or 5 other docs and dermatologists, and I've still had the same rash over and over again. And that's why I keep going from doc to doc. Nobody's ever told me it's not something that's happening to me, but that it's something that's coming from me, right? So they think it's an outside thing, that there's nothing they can do, that they're handicapped, they can't fix it. When in reality, when they're going to see you, who's now becoming this blend of conventional and functional medicine, you say, listen, this is something that's wrong from within, not something that's typically coming from without. And we can give you the crisis care, but if we're going to give you a long-term solution, and I'm not the last doctor you saw for this skin issue while you're on your way to your next doctor, then we've got to change something about you.
Right. And I think too, in our traditional model, we're so limited on time. I think the beautiful thing about this functional space is we create the time with the patient, really have the opportunity to develop a clinician-patient relationship Whereas in traditional practice, you've got 7 or 15 minutes, and it's not by our choice. That's not how we would want to do it. But unfortunately, because of the insurance and all these things, all these extenuating circumstances, our system is really broken. And so as a result, we're like, okay, you got this problem. I mean, derm is very awesome in that way. It's like very visual. It's like, okay, I see the problem. I know what it is. Here's this. Even though in school we learn the basic science, we learn the foundations and the pathways. Unfortunately, in practice in this stage, you have to sweep all of that under the rug and be like, okay, I see what it is. Here's what we do about it. And we don't really have the time in the traditional setting to educate as much as we would like to. And so the physician is dissatisfied and the patient is dissatisfied. And so it's a hard situation.
It is difficult. And I think that's the tough part in general when we look at the two different systems. There's a lot of docs in the conventional model that are trapped because they want to do things differently, but they're not going to get paid to do things differently. And I spoke with one of the docs at ShyCon, and I asked her, she's a medical doctor who's blended in conventional medicine, and I'm like, so she was talking about, her practice and how she's really struggling with what's going on in her practice because she wants to do functional medicine, but she can't get paid for it. So she's like, I wind up donating all this time. I get behind in what I'm doing. I get in trouble with my insurance kind of practice, but I want to do conventional medicine, but I can't get paid for it. Because she's kind of stuck in that model of how to transition.
Yeah, it's a challenge. And for instance, like my husband's a surgeon, and we've talked about he has been trying to he's orthopedics. So with his joint patients and he's dealing with these like morbidly obese patients and talking to them about diet and lifestyle and incorporating turmeric and other things. He's trying, but at the same time, he's hamstrung because these people are not willing to put in the time, the effort. He doesn't have the time. It's a time crunch to get these people optimized. And the other thing is, if something's broke, he's got to fix it. Like there's no, it's a challenge. It is a big challenge, especially for some specialties. I think in primary care or dermatology, where in many ways it is primary care. We have the opportunity. We treat adults, kids. We do surgery. We do pathology. It's kind of a blend of everything. But there are some specialties where it's just not feasible at this stage in the traditional model to be able to incorporate as much as you'd like to. You're pretty trapped.
Yeah, and I'd say there's a big jump for some people, that there's a huge hurdle in people's way sometimes. And if you kind of bring in that orthopedic model, I mean, almost all of my patients with chronic arthritis, I test their gut, and they all have yeast and bacterial overgrowth. And there wasn't a lot written up about the tie between the two until recently. Now we're seeing candidal arthritis papers, we're seeing bacterial arthritis papers, and we're seeing these papers come out. And I presented 2 years ago or 1 year ago at ShyCon on this very topic. And it's one of those things that from an orthopedic standpoint, if they had the time and they had the inkling to educate patients, that it'd help a lot of things down the road. But by the time people are getting there, A, their joints are totally destroyed. And B, you've got a person who's never ever heard this before, that their gut and the bacteria in their gut, which is supposed to be sterile, right?
Right.
There's any way that this stuff could possibly get into their joints and cause arthritis. It's just old age, and it's just, I played sports when I was young, and that's why I have it. Okay.
Right.
Maybe. But maybe you injured the joint, and that was where all the process started. The bacteria and yeast finally had a place to call home and just took up residency. So it's a tough deal.
Yeah.
But let's talk about you and skin. And all of our thyroid people, it's not unusual for them to have skin issues. Okay.
Yeah.
Dry skin, especially. And so for the patient who comes in chronically dry skin from a thyroid perspective, obviously we're going to work on gut. You're going to now start looking at that and saying what you're already probably doing and saying, okay, we got to deal with this gutty context. What are the things that you can kind of recommend to patients who really struggle with that dry skin effect from thyroid physician? What can they do while they're working on their gut?
Well, obviously, while they're working on the gut, incorporating things that help skin cell turnover, foods that are rich in vitamin A, making sure your B vitamins, especially for thyroid function, right? We need those B vitamins. But hydration, emollients to the skin that are pretty bland. I mean, unfortunately, in a lot of commercial products, there's parabens and other things, but there are some companies that even coconut oil, for Pete's sakes. I mean, it's cheap and you got it and just slather it on your skin. It's really the hydration. But I think the biggest issue is getting all the cofactors and vitamins that are necessary to optimize how the body's functioning. Otherwise, it's putting the emollients on is kind of like a Band-Aid as well, because it's really we're not getting to the root of the issue that's contributing to that dry skin.
So if they had dry skin, making sure that they do something to hydrate those upper layers, even though those are layers that are sloughing off, they're still going to get some absorption of those things that are going to help. So coconut oil is a cheapie, right?
Oh gosh, yeah.
Right.
Has it
even olive oil, jojoba oil, like anything that doesn't irritate. I mean, I think just any oil-based product is going to be good. You know, it used to be petrolatum that we would recommend, but we know that, you know, some people, how petrolatum is processed is not always the best, but there's a product actually made by a dermatologist. She's actually my dermatologist, and I love it. It's castor bean oil. So that's one that can be used. There's a product I just came across. I can't even remember what it is. I think it's like, it might be soybean oil, but, you know, then there's issues with soy for some people. But non-petrolatum based oils are, you know, almond oil, jojoba oil, coconut oil. It's really just, you know, hydrating that skin.
That's awesome. That's really awesome. Speaking of putting things on the skin, a big thing that is controversial and people go back and forth between it, and people in the mainstream medium, they think that they need tons and tons of sunscreen. And often we see in our office people who become extremely vitamin D deficient because they're not even getting an ounce of sunlight to be able to make their own vitamin D. Then they have all these chronic health problems that deplete their vitamin D. What is, from a dermatological perspective, what is your aspect on sunscreens? Is it necessary? Is it not necessary? What is your opinion?
Yeah, this is a big one. First of all, my personal opinion, and I think, you know, the American Academy of Dermatology as well shares this, your sunscreen is really your last line of defense. You know, we have our sun protection armamentarium, and some people think that we're on this like crusade to avoid the sun. That's not true. Really, our mission is to educate people so that they can harness the benefits of the sun and minimize the negative aspects, which we know the sun causes direct DNA damage through the UVB rays, indirect through the UVA rays, with creating reactive oxygen species, which sets off the whole inflammatory cascade. So really, we're trying to minimize the negative. So with regards to sunscreen, first of all, most people don't even put on enough to get the full SPF. So this idea that sunscreen is really the cause of the rise in skin cancer, I find challenging. It's not the problem in and of itself. I think it really has a lot to do with our current lifestyle. We're all sitting in front of computers. We're indoors based on latitude, longitude, season. You know, the amount of UV that's actually getting the service to generate that vitamin D is limited in many parts of the country. Like I'm up in Washington, and I think it was actually Dr. Lynch at ChiCom that showed that wonderful map that above some red line, like you're really not getting enough sunshine the majority of the year to even allow your body to produce the vitamin D that it needs. So with regards to sunscreen, we talk about for a full body using a shot glass, an ounce. The likelihood, which means that a 4-ounce bottle, you're done with that in like 4 applications. How long does your bottle of sunscreen last, right? Most people, it lasts months. You might go through 1 bottle of sunscreen in a summer. And so that means that in actuality, people are not using enough. The likelihood that that amount of sunscreen is really jeopardizing their ability to produce the vitamin D, it may contribute, but I don't think it's the main factor. So really what we like to recommend is practice sun safety. I mean, getting outside and getting natural sunshine, but wearing a hat, sunglasses, you know, protective clothing, seeking shade when you can, because you don't want to get burned And you don't want to incur significant damage while you're out there, because I mean, skin cancer is the leading cause of cancer in our country and in many others. And it's not just because of sunscreen, because I can assure you that especially our older patients, they never wore sunscreen. And this is cumulative damage over their lifetime. So to blame it all on sunscreen, I think is just, it's short-sighted, because that's not the whole picture.
Absolutely. Now, speaking about sunscreens, you know, a lot of, there's good sunscreens and there's bad sunscreens. A lot of them out there contain a lot of parabens and petroleum-based products. And, you know, what should people look for in sunscreens to know whether it's good or bad?
Right. So the first thing is to understand that most sunscreens are really covering your UVB rays, which are your burning rays. And that's what the SPF, or sun protection factor, is based off of. It's based off what we call a minimum erythema dose, which is the amount of time that unprotected skin turns red after being exposed to light. So we have these things called Fitzpatrick skin types, 1 being extremely pale, 6 being a very, very dark person. So a Fitzpatrick patient with very fair skin, or Fitzpatrick 1, if they don't have any sun protection, they can go outside and within 5 minutes, they turn red. Not burn, but they start to turn red. If you add sunscreen to that, it's an SPF of 2, then you double the amount of time that they could be out. So when you're looking at sunscreen, SPF is how much time. Like if you burn within 10 minutes normally and you have SPF 50, like you can stay out for, essentially longer than that, maybe up to an hour, depending on your skin type. Most sunscreens have some additional filters in them that protect you from the UVA rays, but we don't have a good scale to measure UVA, nor do we have a good scale to measure the infrared light that is penetrating and causing damage to the skin as well, breaking down our collagen and elastin. So making sure that when you purchase a sunscreen, it says broad spectrum on it. That way you know that most, in this day and age, most are broad spectrum, that it covers your UVA and your UVB rays. Personally, I have very sensitive skin, so I only look for products that have the inorganic ingredients like titanium and zinc. I know that titanium is pretty controversial, and so is zinc because of the nanoparticles, but there's a lot of companies that are producing sunscreens that are non-nano, so the particle sizes are not so small, and the studies have bore out that they really don't absorb past like the stratum corneum. So looking for non-nano sunscreens, the organic ingredients, which are your chemical blockers, like your avobenzones, your oxybenzones, your octinoxates, those are very good as well. But if you have sensitive skin, avobenzone is one of the leading causes of allergic contact dermatitis. So so those are I know that's a lot of information, but it's things to think about, looking at the SPF, anything greater than 50, it blocks out about 99% of the rays. Anything above that, you're not getting significantly more protection. And in fact, there are regulations that will probably cap out at might say 50 plus, but the 70s, the 100s, you're not really getting more bang for your buck with those. And I personally am a bigger fan of the physical blockers with the zinc, just because, for sensitivity of skin. And they've made them much more cosmetically elegant, so you don't have that white sheen. Yeah.
So it's interesting. I think we live in a time where we have more people using sunscreen, yet we probably have more skin cancer, right?
Yes.
And so we have to then think about it and say, you could easily causally, you could say, okay, more skin cancer, more sunscreen use. Obviously, those two things go together, right? And there may be some tie-in. I don't think we can totally rule that out. I think what's probably happening, in my opinion, and I could be totally wrong, right, is that the key is we have people who are sicker. We have cellular systems that are sicker. right? So we have skin cells that aren't nearly as healthy as they used to be. And so people are more likely when they get skin or when they get sun exposure, when they get chemical contact, they just aren't able to adapt to those things the way they should be able to. And it's constant bombardment of, when they're out in the summertime, it's bombardment of sunlight, it's bombardment of chemicals on a system, on a cellular system that's not very sick. And as a society, potentially, their skin gets very little, like in general, like regular small doses of it because we spend so much time in front of computers and radiation. So maybe there's potentially a tie in there. Do you see that as a possibility?
I actually do. I think that's a very important point to raise. You know, as I mentioned, we know that the UVB rays cause direct DNA damage. The UVA rays are more indirect, creating reactive oxygen species. So when our systems are sick, when our pathways are not functioning optimally, you know, our body's doing the best that it can to, defend against these insults. But then the system gets overwhelmed. And so the damage, we can't fight it. And so then the DNA changes happen, mutations occur, and then we wind up with the manifestation, the outcome being skin cancer or any other disease. So yes, to that point, I do think that's incredibly valid.
So yeah, I think because you see, there's a lot of people that just have chronic low-grade inflammation already. They have other autoimmune issues. They have upregulation of their reactive oxygen species and depletion of their glutathione, especially our thyroid patients. So this is my opinion is it's not the sun. It's not the sunblock. It is the state of the human cellular system is just not capable of managing the damage that's occurring, where in a healthy state, a healthy body, and we know there's people that are out in the sun all day, every day, no sunblock, no sunscreen, they get no skin cancer. And maybe they're just more adaptable because they're not as chronically ill and as chronically sick, possibly.
Possibly. I think that's a really good point. You know, I think the other issue with sunscreen is that many people feel that they're invincible. So they just wear their sunscreen. They don't take any of the other sun protective measures. They're half naked. I mean, if you look at the bathing suits, I think it's funny because I created a line of sun protective clothing that I'm like long sleeves, long pants. And then you have these bathing suits that are like a stitch of fabric, but they're UPF 50. Well, that's not going to do you much good when all of your skin is exposed. So I think it's a combination of those things where, you know, when we're indoors, not getting a lot of sun, and then we have the luxury to go on holiday and you go hog wild. You just fry yourself. You're getting this acute exposure, a lot of your skin, and it overwhelms the system. And if the system is already sick, so I think it's a combination of those things. You know, the way that we interpret, well, all I need is sunscreen, I'm good to go, and they don't reapply it every 2 hours as recommended. They don't put on enough that was initially recommended. So, and then if you have a system that's already sluggish, you just can't handle the insult and the injury.
Yeah, I think that's an important factor to play. A few weeks ago, me and my husband were just in Cancun. We were in Mexico, and I would see people that were extremely pale. They'd be laying out. They wouldn't have put no sunscreen on. And then I'd see them later on in the day, and they were looked like a lobster. And I had to think in myself, okay, one, they're not putting the sunscreen on. They probably sit at a desk all day long inside, have not had any sun exposure. And then on top of that, we're at an all-inclusive resort. They're eating probably terrible food, drinking lots of alcohol. We know what that does to the gut and the body, creating inflammation. Do you often see that food factors, things that they're doing that can create inflammation, affect sunscreen and sun protection?
I'm not sure I'm following your question.
So like the foods that people eat and drink, do you see that the inflammation that creates in the body, that can lead to more likely being burnt because there's already a level of inflammation in the body? Oh,
yeah, I would agree. I mean, there aren't any studies. I don't have any data, but you would anticipate that would make a lot of sense. Mm-hmm. The other thing too, especially with alcohol, your inhibitions are down. You probably stay out a lot longer than you otherwise would, because if you're feeling good, you're not going to feel the sun. I mean, your skin is like this incredible, has sensory organ, but if you're kind of numb to that, you're not going to pay attention either. So I think, to the point earlier, foods that are processed, kind of junk foods that aren't serving your body well, that are not full of nutrients, they're just further depleting the factors that you need to be able to combat some of this inflammation, not only that's being caused by the foods you're eating, but the inflammation from the sun. You just have no resources to manage it.
I think I kind of liken it to taking two people who are going to run a marathon, right? If you wouldn't think that you could just get up off the couch and go run a marathon and there's not going to be a problem, right? Kind of like if you haven't been out in the sun at all, that you're going to get up off the couch and go out and spend 12 hours in the bright sun and not expect there to be some damage. And we see the skin damage, but we don't even consider the fact, many people, that the damage that's occurring internally as a result of all that burning that's occurring.
Right.
And if you use that same line of thinking, if you took the person who eats well, who rests well, they do everything else well, they will probably get to maybe maybe they finish the marathon. They don't finish it, at top, in the winning time, but they finish it. But the person who's obese, overweight, chronically inflamed, has a really lousy diet and lifestyle, they're probably going to punk out somewhere around 3 miles and be much more compromised by what they tried to do. I think we have to look at the sun exposure the same way. If the person's a bit healthier, they do a lot of the right things, they're probably going to be more adaptable. But if they're a person who's used to being out in the sun a little bit more, they take some of those precautions, they're not out at the high time of the day, they're getting their sun exposure in less kind of potent times of the day, they're probably going to tolerate a little. I want to bring up, and it's a question that I don't know that I have the right answer to, so I figure you're the expert to do, is, when I'm taking care of patients and I'm doing an exam, definitely I'm looking for abnormal looking things on their skin as I just kind of go through things. And I had a gentleman that on his calf, I saw this mole or mark, and I was like, I don't know if that looks good. I think you should get that checked out. And we sent him off to the dermatologist to get it checked out. He came back into the office for a follow-up, and I said, how did it go? He said, yep, there was no problem with that. I'm like, oh, all right, good. He said, but up on my thigh, up almost near his groin area, he said, I had a bad mark there, and that was a intense form that he had to get taken care of and done. But his question was, and maybe I want to make sure I don't give the wrong answer. So his question was, listen, that part of my body has never seen the sun. Yeah. So why am I getting skin cancer in places that really never, ever get exposure? If it's the sun, why is it not where I have exposure? Why is it where I don't get exposure?
Right. That's a really good question. And not knowing what type of skin cancer it was, let's just say it was melanoma, which is the deadliest form of skin cancer. We know that the sun exposure is only one part of the equation. And there's a difference between our non-melanoma skin cancers, which are your basal, your squamous, versus your melanoma skin cancer. So squamous cell carcinoma is kind of a chronic exposure over a lifetime, like cumulative, just being hit again and again, day after day. Our outdoor workers, people who are on their boats getting it reflect off the water and things like that. Melanoma has been associated more with this acute intermittent sun exposure. So going to Cancun and getting a burn and doing that a couple of times a year, year after year after year. But we also know that melanoma can occur where the sun doesn't shine, up by the groin or in the groin, on the toenails, bottoms of the feet, in the genitalia, in your mouth, in your eyes. We have pigment producing cells kind of everywhere for the most part. And so there are certain genetic abnormalities that are inherited. So it's like that, that concept of the two-hit hypothesis, and you already have a vulnerability, what your genetic predisposition is. And then if you are not eating well, moving well, sleeping well, all of those things, you get this, again, overwhelm to the system, and things evolve, change, degrade over time. So I think that is and then the sun, so sun is a factor, but it's not the entire story for skin cancer.
And so it goes back to what we talk about at ChiCon, which goes back to what Dr. Eric and I talk about all the time. There are definitely genetic predispositions to things, but it is the epigenetics that play the biggest role in what causes the problems. Too often, people want to defer to their genetics as their problem,
right?
And they want, and there's all these programs now that you can download your genetic data and you can treat based on your genetic data. Matter of fact, somebody just came out with a multivitamin based on your genetic report, which is craziness because it doesn't make sense. And really we're going back to the same model, just a different philosophy, but really the same model. Here's your problem. It's your genes. I'm going to give you something for it. And taking that diet and lifestyle factor back out of it again. There's nothing you can do. You're always going to be B6 deficient, or you're always going to need B12. It's craziness. But in this guy's situation, I forget the type of cancer. I didn't even think about that until we just started talking about it. But I think the key part of that is that it probably had to do more, as you were saying, the other lifestyle factors than it was the sun exposure from where. And so he is a guy that probably could have benefited and can benefit and can continue to benefit from better diet and lifestyle, because he's a great guy, but diet and lifestyle is not great. And so that's the biggest factor.
Diet definitely plays a big role in it. And a lot of our listeners know the foods that they need to avoid. We've talked about it over and over again about, reducing sugars, reducing carbohydrates. But when it comes to the skin, who doesn't want to have better looking skin? So can you give us some foods that will help to nourish our skin, help to improve the quality of our skin, that you recommend to maybe your patients?
Yeah, so foods that are rich in polyphenols are going to be ones to go to. And I know it's going to be summertime, so there's a lot of great fruits and veggies that are out there. There's been a lot of research, and there's in pomegranate, right? And there's a big boom of pomegranate and pomegranate juice, and that's for good reason, because it suppresses inflammatory cell signaling. So if you're a fan of pomegranates, that would be one. But there's also other these anthocyanidins, I'm going to not even pronounce right, anthocyanidins, that are in pomegranate, but also you can find them in berries, red cabbage, purple sweet potatoes, carrots, tomatoes, dark grapes. So those fruits and veggies are also rich in other vitamins as well, but specifically for skin health, and they've been shown to have antimicrobial properties, antioxidants, anti-proliferative, as well as anti-carcinogenic. So kind of stock up on your I don't know, purple,
eat the rainbow.
Veggies. Eat the rainbow. I mean, strawberries, apples, cucumbers are also rich in something called fisetin, which is part of the flavonoid, one of the flavonols. And so these have been shown to be very helpful, at least in research studies, for skin health and optimizing skin health, and especially with regards to skin cancer.
Awesome.
Prevention. Yeah.
So I would love to keep talking to you, but I think we've got to kind of wrap this one up.
Yeah.
So if you had to, and we'd love to get you back on, because we barely touched the surface on stuff we can talk about. So we'll definitely kind of plan to get you back on here. But what would get, if you were, we talked about from a dietary standpoint, we talked about eating kind of the fruits, vegetables, eat all colors of the rainbow, because those foods are the foods that have the nutrients, that as long as you have good digestion and good absorption of those things, they can really help out your health and your skin quality. We talked about putting oils, even coconut oil, some of the healthy oils on the skin to kind of nurture the skin from externally, working on the gut internally. You talked about hydrating, making sure you get proper hydration. This helps support the tissues. What kind of final 2 or 3 pieces would you give the listeners that they could do to improve their skin quality?
First of all, don't go nuts. Like, you do the best that you can. You start where you are. But the top things would be go into your bathroom, your like your shower, whatever products you use the most, and just look at them and look for ingredients like parabens, phthalates. Clean out, just detox your beauty cabinet. The second is, like you just said, stock your fridge with color and enjoy it, because that's, variety is that spice of life, and it also will benefit your skin. And do an experiment with dairy. Cut it out and see what happens. It's amazing what it's done for some teenagers, I tell you that.
Oh, yeah.
Yeah, definitely I see a big change when kids are willing to just, if they can do a little bit of dairy and carb restriction.
Yeah.
Skin quality does tremendous.
Yeah. Throw that soda out the window. We don't need it.
Well, if it's diet, it's probably fine, right?
Oh my gosh, don't even get me started.
All right, so that's a whole other podcast. Keira, we appreciate you being on. It was great to have you on. Can you just let our listeners know if they're looking for help in the world of dermatology and looking for somebody who's got that kind of nod towards a functional approach, how can they get a hold of you?
So that you can contact me at Dr. Barr at chooseresilience.com and also resilienthealthinstitute.com.
Right, and I'll post all your information on there. But we really appreciate you being on. That was probably the fastest 45 minutes so far. I got to run or I'm going to be in the doghouse. So Dr. Erica, thank you for being back on again. It was great. I'm going to cut everybody knows where we are by this point. So I'm going to cut this one short. Keira, thank you so much.
Thank you.
And if you're listening to the podcast and you enjoyed this one, please leave some nice comments for us. We will be sure to get Dr. Barr back on so we can learn more, because we didn't even get to the chemicals in our food or in the beauty products and lipstick and hairspray and all the other stuff.
Oh, yeah.
Not that I'm using hairspray on, but all the stuff that people put on their skin, especially women, have a tendency to really make their lives just way more toxic by what we're putting on the skin. And you can explain why some of that stuff may not be so good. So let's wrap this one up. Thank you so much, Dr. Eric. Seeing you again. And Dr. Keira, great to see you. Thanks for coming on.
Have a great day.
You got it. Take care.
All right. Bye.